I'm Dr. Henry Nagai. I'm public health scientist and chief of party at JSI. And I work on the USAID Strengthening the Care Continuum project, which is supported by PEPFAR through USAID Ghana. So I've been working in the field of HIV for over 20 years. I have been in a district hospital where HIV treatment started, where we never had treatment for patients who were positive, really difficult. We had patients who had to get their treatment from abroad. And I think one of the best things that have happened to humanity, to the field of HIV care, has been the President Emergency Funds for AIDS Relief, that is PEPFAR. Because PEPFAR came in at a time that countries need some breakthrough in getting life-saving medications for HIV treatment. And I think that if there's one thing that has changed the face of HIV care, that has brought hope, that has improved lives, that has improved health outcomes for persons living with HIV. People living with HIV used not to have hope. They think that was a death sentence. But PEPFAR came in at the right time and have saved many lives because treatment became available and accessible in developing countries, including Ghana. I think that PEPFAR should continue to strengthen health systems. There should be opportunity for integration. PEPFAR can support integration to ensure that there's sustainability of the investment that has taken place. I think that more and more local organizations, civil society organizations, have learned how we can work together to support treatment and to make sure that treatment and health outcomes are sustainable. And PEPFAR should be able to support this going forward and make sure that the investments that have taken place, are sustained. I can tell you that without PEPFAR, Ghana would not have been able to make progress in providing services to key populations. The PEPFAR program that I happen to be the director started as a key population program in 2016. And before that, the US government invested heavily in the research and the surveys that led to the mapping and size estimation of key populations so that we know where key populations are, what they need, etc. And so the Care Continuum program project focused on key populations to start with. And in Ghana, key populations are defined as female sex workers, men who have sex with men, transgender people, and then also the non-paying partners of sex workers. And these populations, for example, the men who have sex with men population, the prevalence of HIV is around 18.2, compared to less than 2% in the general population. So PEPFAR has helped in ring fencing and focusing on this population to try to reduce infection among the population, because we know that they are stigmatized in Ghana. There's a lot of homophobia, and there's a lot of practices that prevent them from accessing health services.